Welcome back to another episode on the Wellness and Recovery Podcast. I'm your host, Zachary Rios. Today's episode is all about alcohol use disorder, a topic that affects millions but is still surrounded by stigma and misunderstanding. This episode is brought to you by Rios Enterprise, empowering patients to make informed decisions about their care. For those of you who are new here, I'm a board-certified primary care and addiction treatment nurse practitioner practicing in New Jersey and Pennsylvania. My mission is to educate, empower, and support those walking in a path of recovery or helping someone who is. I also provide educational guidelines on primary care needs. Let's get into today's topic. Alcohol use disorder, or AUD, is a medical condition, not a moral failing or a lack of willpower. It's characterized by the inability to stop or control alcohol use despite negative consequences in relationship, work, and health. Alcohol use disorder ranges from mild to severe, and it's important to know that help is available at every level. Now, what happens to the brain for those who are drinking alcohol, whether it's a binge drinking or chronic alcohol use? Alcohol hijacks the brain's reward system. It boosts dopamine, a chemical that gives you a sense of pleasure, but over time, the brain becomes less sensitive to the dopamine. This means you need alcohol to feel the same effect, and natural sources of pleasure, like relationships or hobbies, they stop being fulfilling. Alcohol also impacts the prefrontal cortex, the part of the brain responsible for decision making and impulse control. That's why people with alcohol use disorder often continue drinking despite knowing the harm it causes. It's not a lack of logic, it's the brain being rewired. The good news is, alcohol use disorder is treatable. There are 3 pillars of effective treatment. Number 1, behavioral therapies. This includes cognitive behavioral therapy and motivational interviewing, both of which help change patterns of thinking and behavior around alcohol use. Number 2, medications. Yes, there are FDA-approved medications for the treatment of alcohol use disorder. You have naltrexone, which helps reduce cravings, acamprosate, which helps stabilizes the brain's chemistry post-withdrawal, and disulfiram, which creates unpleasant effects if you were to drink alcohol, which helps with deterrence. Then you have number 3, your support system. Recovery doesn't happen in isolation. Peer groups like AA, Smart Recovery, or working with a sponsor or recovery coach can significantly increase success rates. And remember, treatment's not a one-size-fits-all. Whether you're interested in harm reduction, abstinence, or somewhere in between, there's always a path forward. Now let's talk long-term effects. Long-term effects of untreated alcohol can lead to cognitive decline. Chronic alcohol use can shrink the brain's volume, especially in areas involved with memory and learning. Liver damage, such as fatty liver, hepatitis, cirrhosis, these are common in long-term use of alcohol and can be very life-threatening. It can lead to heart problems since alcohol raises the blood pressure. It can lead to heart disease, increased risk for cancers such as breast, liver, and esophageal cancer. And mentally, depression, anxiety, and even suicidal ideations are often intensified by the long-term use of alcohol. But here's the hopeful part. The brain can heal itself. Neuroplasticity allows the brain to form new pathways once alcohol use stops. Many people see improvements in mood, memory, and physical health within months of quitting or cutting back. In closing, alcohol use disorder is complex, but you are not alone, and recovery is possible. Whether you're struggling yourself or supporting someone who is, knowledge is power, and compassion is essential. If this episode resonated with you, please share it. It might be the resource that can change someone's life. Again, this episode is brought to you by Rios Enterprise, empowering patients to make informed decision-making in their care. Hit that like button, subscribe, and share so that everyone can get this information that needs to hear it. I'm Zachary Rios, and thank you for tuning in to Wellness and Recovery. Until next time, take care of yourselves and each other.